Thanks for joining us. I'm Mabel, Jong. This is continuing coverage of content from the World Healthcare Congress. Thanks for joining us. And we're talking birth centers. There's about 200 of them in the United States now. In our studio right now, we have Stephen Hall of Babymoon Inn, and Linda Davis is an independent consultant on birth centers. Welcome to you both.
Thank you so much.
Thank you.
So first of all, give me the landscape. I mentioned 200 birth centers in the United States. Is that an accurate number?
I think we have a little bit more than 200, and then there's about 100 of those are accredited birth centers.
Okay. And right now, do you see growing interest in establishing birth centers in cities?
Oh, absolutely. So birth centers have been growing at a pretty good clip over the last probably 10 years due to the improved outcomes and lower cost.
I think also social media has helped because there's much more awareness of millennials. They're out searching all the time when they're pregnant about what their options are and what the choices are for them for having babies.
Okay.
And
what do you attribute the better outcomes to?
More upfront work, prevention, more attention during the prenatal care, much more attention during labor and delivery, and fewer interventions. The interventions really often cause a cascading of complications and other things during labor and delivery. And physicians are trained to do more and to do things and to find problems, and they do, whether they're there or not sometimes. So,
okay.
Yeah.
And this is different from what you would find in a traditional hospital setting?
Yes.
Yeah, so I would say a couple of the big differences are the personalized care that a midwife is going to offer. They're not treating every mom the same. So whereas in a physician appointment, you might go in for I'd say wait a half an hour for a 5-minute appointment, maybe a 10-minute appointment. At a birth center, you might wait up to 5 minutes for your 30 minutes to an hour with a midwife. So on the prenatal side, it's a lot different. At the birth itself, you also have a midwife who's taking care of the mom at the beginning of labor all the way through, instead of a nurse who's seeing several patients in the hospital. And so kind of the inverse is flipped. We not only have a midwife, there's usually a second or third person at the birth as well, taking care of one mom.
Mm-hmm. And how does this compare with what we see in hospitals? Actually, let me rephrase that. What about costs? We should switch to costs. Can you give me a comparable between a birth center delivery and a hospital delivery?
It's hard to generalize because obviously charges vary dramatically by hospital and by market, but generally the facility fee is about half or less than what a physician or what a hospital would charge for a normal vaginal delivery. Mm-hmm. And then the professional fee, I'm not sure how that compares to an OB, but in some cases it's about the same, or it might be a bit less.
Okay.
So tremendous savings, but the savings also come from reduced C-sections and reduced interventions and reduced complications. And so the C-section rate tends to be for the same low-risk population about 10% or less in midwifery birth centers, and for OBs now the U.S. national average is around 29 or 30%. So it's 3 times higher in a hospital.
Did you have something to add to that?
I was going to say, and fewer C-sections means fewer NICU stays.
Okay. What else did you want to add? You're speaking on a panel here on this very topic. Are there takeaways that we should know about?
I would say one of the things that we found here at the conference is just how receptive the brokers and the employers are to this concept and getting it into their plans correctly. What we found is that a lot of insurance plans with the employers don't define birth centers properly. Their benefits aren't designed really to encourage moms to use birth centers, or for the insurance companies to even contract with birth centers. So we found a really strong reception to that message, and I think that a lot of the brokers and employers are willing to change their language in their benefit plans.
The reason we were chosen was because we are an example of high-value care. One of the individuals putting this conference together knew me and knew of birth centers and gave us the opportunity to really talk. It fits so beautifully into the high-value care option, especially now that our maternity care system in this country is not great. We know maternal mortality is rising. We know that we don't compare well to other Western countries in terms of infant mortality, and our costs are off the chart. So it's really time.
Okay. Thank you to you both. I really appreciate it.
Thank you. Appreciate it.
Okay.